saying what you might suggest as well. So to introduce this supply side issues panel, progress, incentives, and barriers, we have Kathy Pauley, who's the Executive Director of FMI Food Marketing Institute, Barry Popkin from UNC Chapel Hill, Julie Garrell and Amy Schlechter from the Convergence Center, and Eric Henges, did I say that right, Eric? At the International Life Sciences Institute. Thank you all so much for joining us, and we'll start with you, Kathy. Does the clicker work, Elaine? Just this little right there.
Okay. Well, good morning, everyone. Delighted to be with you today, and Tim actually set my presentation up pretty well, of giving you a little bit of an overview of what supermarkets do today and what they look like and their profit margins. I'm going to take a little bit of a deeper dive and give you some examples of what supermarkets today are doing for all of our customers, whether low income or high income and everyone in between, as far as trying to make those nudges and get people to make healthier choices while they're in the stores. So just a quick little overview about FMI. We are the trade association that represents the supermarkets. We have 1,225 food retail and wholesale members around the U.S. that operate 40,000 stores nationwide. I'm a pharmacist by education, so I always have to put in that we operate 25,000 pharmacies nationwide within those stores as well. But you'll see we're a $770 billion combined annual sales volume industry, operating in 65 different countries. So today's supermarket, this has been alluded to this morning, on average we sell about 43,000 items in our stores. The typical consumer visits a supermarket 2.2 times per week. We provide essential services in the communities. You know, it's working with the local churches, working with the food banks, working with a lot of the community groups, of just being part of that community is a really strong connection that our stores have, from the store manager all the way down to the cashiers up front, of really getting involved in their local communities. Typical grocery store, Tim alluded to this too, typical grocery store's profit after taxes is 1.3%. The average store takes in about $6,000 a week in profit, so you'll see it's real slim, and again, as Tim said, they're in business to make a profit, and they need to stay profitable in order to maintain that business and remain in that community. And differentiation from the competition is really key to a retailer's success. And 87% of our members told us in our benchmark survey that they view health and wellness as a competitive advantage. So that gets down to that point of, yeah, we may be doing some great things in our stores, we're not really necessarily interested in sharing it with our competition and really rallying all around to get the same answer of how we make those nudges for health and wellness. We've got a lot of concept testing going on in our stores. We have pharmacies and dietitians and nutritionists and store associates all getting together to put together in-store programs and in-store shopping tours, a lot of different types of merchandising strategy, what they're doing with the front checkout lanes, again, how they're driving people through the store, produce first, produce last, produce middle. So a lot of real good thought is going into how we can help shoppers make nudges to have a healthier diet. This is actually CDC, and then we put this in a research report that we do every year. This is actually our 22nd year of doing a report with Prevention Magazine, Rodale Publishing, about customers' views on shopping for health. And what you're going to hear from me today is information we have from Shopping for Health 2014, information from our Health and Wellness Retailer Contribution Study, which I see Kate Olander in the back there. She was our intern last summer. She's now with Tufts University getting her master's in public health, and really did the work behind getting the input from our retailers about what they are offering today in our stores. And then also we have our trends benchmarking report that we do with the Hartman Group that really talks about what consumers are saying about their supermarkets and how we interact with them. So this is basically that, just to tee it up here, of the perception of there's a real disconnect between what parents think about their kids' weight and the actual obese and overweight statistics that we have in our country, and parents just don't see often see their kids as being as overweight or even in the obese category. So definitely something for us to all work on. So let me take you on a store tour of what our members tell us they're doing in the health and wellness area. I have the great fortune of staffing our Health and Wellness Council at FMI, and it's composed of both our retail members, our wholesale members, and our associate members, who are the Kellogg's and the service providers and other CPG manufacturers around. And it helps us at FMI. It gives me guidance on what we do day to day with health and wellness efforts and putting together programs and services for them. It's pharmacists, it's dietitians, it's marketers, it's merchandisers. So this is what they have told us they are doing at store level. So let me, without further ado, get right into some of the information. Store tours, you'll see here, we have an awful large percent of our members today are offering store tours. And it ranges anywhere from just healthy eating store tours. I was on one locally with some preschool kids about how you pack a healthy snack for preschool. And these are really growing around the country, and they're offering, as you can see, well, I don't know if you can see here, I was having a hard time from my chair, healthy eating store tours for diabetes customers, store tours about weight management, store tours specifically for parents with children, store tours for the children themselves, people who are looking to manage heart disease, hypertension. And they're really, they're free of charge to customers in the store and are really becoming commonplace across the country of just a great way to learn. You go into that store, there was a picture of how many SKUs, those 43,000 SKUs. How do you really shop that store for what you're looking to get out of it? Then here are some statistics about stores that identify specific products on their shelves. You'll see, no surprise, I guess that gluten-free has been around for a little while now. So 83% of the stores are offering gluten-free specific products on their shelves. Organic products, low sodium, and you'll see, even the vegetarian, vegan, and soy products are starting to be labeled a little bit more on the store shelves themselves, so people can help identify what they're looking for. 50% of our members who responded to the study said that they have front-of-pack labeling for private brands in certain areas. You'll see here again, gluten-free tops the list of what they're labeling in their private brand areas. And over half the retailers are displaying healthy for you items on their aisle end caps. And this gets back to earlier, we heard about slotting fees and allowances that are paid by manufacturers to get that prime real estate. A lot of our members are starting to take that real estate back and use it for their private brands so they can really talk about some of their priorities in the store, what they're trying to do with those private brand labels. 75% of the folks who responded to our study also said that they offer healthy recipes in more than one location within their stores. Topping this is really on their company websites. The large majority of our members have websites, if not all of our members have websites, and I think it would be really hard to find a retailer today in the supermarket segment that doesn't have a health and wellness section of that website that really gives you good tips. It connects you to perhaps their in-store dietitian, their corporate dietitian. Some cases they actually have a physician on board who comes and does a chat with them or a blog once a week. But a lot of the healthy recipes are on the websites. They're printed in stores. They're in store kiosks. They may be in their circular, they may be in a newsletter that they do, but they're really trying to give really good guidance on, I have chicken in my freezer, what can I do with chicken really quickly? And a lot of these stores are actually putting together at the front of the store, more and more we're seeing this, at the front of the store, here's chicken, here's the vegetable, here's the sauce, and quickly you can put together that family meal and get home and do it in a very affordable way. 60% of shoppers, this is from one of those shopping for health quotes, 60% of shoppers think it's too hard to change their eating habits. I think that goes to why we're all here today. We know we need to make better choices, but it's just not the way we were fine-tuned, and it's not what we think about first. So our retailers are really offering some amazing things these days. 75% are offering wellness classes. And again, that might just be, how do I shop every aisle of that store? When I hit that store as a shopper, how do I get through the clutter? How do I make good choices in every aisle of that store? How do I make the best choices for my family and myself? 70% of our members are offering cooking classes. A lot of the cooking classes are now, we have many stores who have supermarket chefs who are coming on board. So it's a combination of the chef and the retail dietitian, and sometimes even the pharmacist who helps to identify who are the hypertensive patients coming in, who are the folks who are taking cholesterol-lowering drugs. And I've heard a lot of our members on the pharmacy side say if they do their job well, they work in a food market. If they do their job well, people should be taking less medication from them and shopping more healthfully within the store. Supermarkets have a lot of family-friendly offerings and services going on. Kid-focused events, 90% of our stores said that yes, we have some type of a kid-focused event. Again, it might be a class, it might be a store tour, it might be, find 5 healthy fruits or vegetables in the store and you get a coloring book. There's a lot of little nudges that really help parents who are bringing their kids in the store, help them with, mommy, I want the candy, putting them on a mission to go in a different direction. Candy-free checkout lanes. A lot of our stores have tried this. It may be only 1 or 2 lanes within their store. Some have gone down that path. Some have pulled some of those checkout lanes back because they weren't as successful. And you'll see in where there is a candy-free checkout lane, in some areas it's healthy snacks. In other areas it may be batteries and Kleenex and whatever, but something that's not candy-free. But I've seen our stores go from, they took half of their checkouts, they're down to 2 checkouts, and they're really just trying to tweak. And I think that's where it comes down to the autonomy of the store managers and the community of knowing what's going to work best in the community that they serve. 98% of our stores said that they did have some type of a health and wellness website or an area within their website that is dedicated to health and wellness. You'll see they have healthy recipes. A lot of our members are now offering live chats with their dietitians, nutrition Q&A answering, health articles, a customer question area specific for parents, specific for children, specific area for seniors. So there's a lot of differentiation. Again, you're going to see that based on the community where that store is based, talking to their community specifically about what they think their shoppers are looking for. This is a real growing trend within the grocery store, if you're not familiar with it, but dietitians being hired by grocery stores. Right now we've got about 85% of our stores have at least 1 dietitian employed corporately. These are usually the folks that you'll see who are that Q&A person on their website. They write their in-store video scripts and the on-the-air radio talking about the healthy recipes. They're involved in their family meal programs. They're involved in writing their newsletter. So that's really the touch point of, and they help merchants with the merchandising of certain areas. If here's some really good healthy recipes, let me talk to you, Mr. Merchant and marketer, about how we can engage our shoppers in making those choices, but how do we merchandise the store for that as well. About 30% of our stores have dietitians in store. Hy-Vee was about the first based out of West Des Moines, Iowa, was the first store to really have a dietitian in every store. Wakefern, who operates their stores under the ShopRite banner up in the Northeast, and now has a dietitian in just about every store. And we're seeing this as a trend, that they're coming out of the corporate world and going down at least into a regional area where they may have 20 or 30 stores they're responsible for, all the way down to in-store. So just to wrap up, I wanted to give you a couple ideas here of bringing what we just heard to life. Giant Eagle, this is the, 2 of their dietitians, and you'll see here they have something called aisle excursions. Again, it's how do you shop in the store? I know I need to eat healthier. There's a lot of products. There's a lot of clutter out there. Sometimes I think it helps to just have that real person with you, taking you through the store and helping you cut through some of that clutter, because you're not going to read all of the labels. Redner's, I picked Meredith here because we have a Gold Plate Award, which is for the most innovative family meals campaign, and their Affordable Choices program was all about, again, putting together that family meal very quickly in a very affordable way. Weiss does some great things. They have Healthy Bite magazines. They also have, you'll see, here's the menu of, we can do Cart Smart store tours, kids tours, seminars, and cooking demonstrations. They'll go out and they can send their dietitians out into the community for health fairs. Again, here's Cooking Together, Cooking Forever, free classes of parents and kids coming in and learning how to cook, and it's available for all income levels at no charge. Meyer they work a lot with their chef. It's their nutrition team, their chefs, and they have folks who are actually physical activity coordinators, because they're a super center that sells exercise equipment, so they try to put the whole thing together. And then we have partnered at FMI with the Grocery Manufacturers Association on Facts Up Front, which is the voluntary Facts Up Front nutrition labeling program that takes the nutrition facts panel and very quickly tells a shopper about what's in that product. So again, our focus at retail is to continue to support the efforts to move diets in a healthier direction, whether you're a low-income, middle-income, high-income person. And really, those nudge strategies, we have learned, and I've heard this from day one when I entered the doors of FMI about 7 years ago, of our customers do not want us to preach at them. They want education, they want information. If we tell them this is what you can do and this is what you shouldn't do, it's going to backfire. And I hear that time and time again. So that's it. While supermarkets are in the business to sell food, we really are in the business of meeting the customer's needs, and that's our top priority. Thanks.
Hi, I'm going to try to take you through using this first. Okay, so I'm going to give you a little sense of our group and then talk a lot about food purchasing in a whole array of different ways that'll look at slice and dice the pie that we're seeing on our diets and what we're purchasing in ways that you haven't seen before and go forward. So we began around 4 years ago, looking to try to evaluate the Healthy Weight Commitment Foundation, which is a commitment of the food industry. We created a system that could allow us to monitor from the factory all the way through to people's diet. What I'm going to be presenting here is only the kind of the factory to the purchase, not the purchase into the dietary intake side. And we're doing other work with that I noted there. So one of the first things is the food purchase data, whether you call it IRI or HomeScan, it all comes from the same database now. They merged, it's all the same. It's purchase data. It's not consumed data. It's not like people here think of as 24-hour recall or 7-day whatever recalls or records or what have you. It's household data. We do have individual single-headed households and so on, but it's household purchases, household consumption. It misses away from home food, and there is some other problems with underreporting, just like everything else, particularly for kind of random purchases. It represents 76 markets in this country. For most of them, we have around 700 to 1,000 households a month in each one now, and it's a very big amount of food out there. We have about 600,000 barcodes and about 200,000 unique products in terms of ingredients right now in our food supply. So a lot of foods out there in this world at the UPC level. As you see that while there are thousands of companies in the U.S. and manufacturers, we have 20 to 30 that really are the dominant players. We have 4 major retailers. You put Safeway in as a 5th. They've really gotten a lot of the retail sector. We have the consumers. We have all these relationships between the food manufacturers and the retailers, which are changing and very, very dynamic, as I'll show you in a second. And the retailers are moving forward in very interesting ways. So we get now, the recession decreased the amount of away-from-home consumption. Today we're consuming about 31% of our food away from home. The rest comes out of this sector, this consumer packaged good food and beverage sector. Even the produce side, more and more of it's packaged and barcoded. But there still are loose items that we don't account for well with these data sets, very, very horribly, as USDA has shown. I'm going to focus a little bit on calories. I'll show a few little things on saturated fats, sugar, and sodium. And first of all, we've gone down in the last 12, 13 years, and we've shown it in at least one publication and a couple others in the econ journals coming out, that we've gone down in our purchases. This is unadjusted. When we adjust for every social, demographic, and economic thing and market level factors, we've still gone down in our purchases in calories per capita per day. More for households with kids, much more, double than what we've done for households without kids. We've shifted toward ready to heat over ready to eat, and we've done lots of other things going on in this country, in this area, that I don't go into here because it could take all day. One of the interesting things is the big shift toward private label. And this is not a shift that is going to stop. For example, the UK, 80 to 90% of its products are private label. Today, we're only 30%, having gone up from 12% in 1990, and we're just growing exponentially. And given the rate of return differential for private label over other, it's going to grow and grow and grow. This is not adjusted. I had a whole bunch of data on private label, but they are cheaper in general, not for every product group, but for almost all product groups than branded products. Branded would be a Coke or a Pepsi versus a private label version of the same item. So this is going to be one of the trends in the future. These are the kind of categories we deal with when we think of these foods. So I'm going to focus, Okay. I'm going to focus mainly on mass merchandisers and grocery, because the supermarket, because those are, and the grocery, because those are really the dominant players, although club stores are growing up, and you'll just kind of see in the next one, the blue, maybe I can do it on here. This group here is the Walmarts and the Targets. That's really grown. This group is the Kroger's and Safeway dominated sector. It's really declining somewhat. You see the club stores at the bottom growing. The ethnic, the Whole Foods, and the others really haven't changed all that much in proportion of the sales. The market's changed, of course, and so on. But that's kind of the broad, big picture. When you think of things like energy density, sodium density, and so on, now these are not standardized in a way I can compare for the same product group. I haven't like age standardized, food group standardized. So these are just, if you went to grocery stores, you're actually buying more calorie dense products than if you go to club, than you go to ethnic. You see which is rising and which are not there. But this is calories per 100 grams, which is a measure we use for energy density, just to get a sense of how it's changing for some and not others. And this is a second way of looking at these energy dense for all of these in regressions, just come with the reference group being the grocery chains. You see the ethnic groups going up, and generally, everybody else has gone down in energy density of purchases over time, all the other groups in the country. One of the interesting things is sodium was going down, and it started to slightly upgrade in the last couple of years again. We don't know what this means for total sodium intake because we haven't really looked at that yet. This is just showing you for these different stores. So they're very, very different kind of profiles. So where are people buying their products? The good is that we've seen this downward trend in energy density, total calories purchased, we've seen the decrease in away from home slightly toward this sector, and that's part of the reason why the ready-to-heat kinds of products have really grown in this sector. We're seeing general downward trends in a lot of the nutrients we're concerned with. The kind of the bad side is that the convenience stores, which I didn't really point out very much there, really still are the most energy, sugar, saturated fat, sodium dense kind of, in general, what people buy from them. Now, we haven't done the work where we're doing the exact same comparison. Let's say comparing salty snacks from the beverage stores versus salty snacks from the convenience versus the others. So this is just kind of a different perspective. What do people buy from these stores? And they buy worse products. That's not to say the stores don't have the same array of good and bad, although they don't really when you look at the whole offering list. The mass merchandisers are the next highest sugar, fat, and sodium dense that I showed up there, and the ugly is that saturated fat density is really increasing for a grocery sector. That's the Kroger's, that's the Safeways, and the others. And we may be seeing a reversal of the sodium trend. Again, more work has to be done. I just was showing that by the different groups there. So I want to just show you Walmart as a case study of kind of a huge growth sector. And I'll show you some things about Walmart, how much people are buying. It's really gone up, and who's shopping at it. And low-income people are shopping at it more and more, but not blacks. probably the locational factors, which may be why Walmart is now beginning to put in these small little Walmarts, but they're still a teeny tiny piece of the market, trivial in fact. But this is the percentage of shoppers. 82% of Americans buy something during the year from Walmarts. When you look at this in 2000, so the top bar is averages about 68% of their purchases. The next one averages about 18%. You see on the left the low and middle income, and then you see in 2012 the shift upward. You see the proportion of purchases from Walmart really going up. Again, a sign, just like the private label sign, of Americans becoming much more price conscious in all their purchases and moving toward private label, moving toward Walmart and other stores like that, and so forth. Walmart purchases had a higher percentage of calorie-dense, nutrient-poor food groups in general than they did from the other stores when we compare Walmart and the other stores, but it's shifting. Walmart in 2000 had about 17% of the calories were savory snacks. Today it's down to 10% of the calories from them. You can see the same for other food groups, total sugar and so forth. That's still not standardizing for the product group and comparing them. That's something we'll be doing, but I just wanted to give you a sense of this one major player. So I've tried to give you kind of a sense of the dynamics of this market. The retail market is really shifting. And I see the way the private label's going, and as a good economist, I would bet we'll be somewhere near, be going toward UK territory in the next 30 years, with private label really moving up in the sector. And one of the things to understand for each of you here about private label, they define the product. So if I'm Walmart and I have private label, I define what goes into it. It's not Coke or Pepsi that defines it, or whoever they use to grow. So they create that nutrient profile. So retailers are becoming a bigger player than they used to be in the diets of Americans, and that's one thing to come out of this. So we're going to, in the next year, have finished linking all these barcodes very, very systematically and cooking the brownies and so on, and linking it over to the foods in the Hanes survey so that we can then link these kind of changes in these items. And by the way, the nutrients are really changing quickly in the consumer packaged goods. Every year we've had 20 to 25% shift in one or more of the nutrients on the nutrition facts panel. And the ingredients are really changing also as we look at both of them. So it's a very rapidly changing kind of picture. And we have to keep up each year to keep changing our food composition to do it. So that's why this crosswalk linking the barcodes, nutrition facts panels to the Hanes data will allow us to see how diets are changing in a way that we can't do otherwise. We're also estimating added sugar in each of these products. We've done it for all the beverages, and we're moving on to the food groups in some of our other work. And using ingredients and the nutrient profile of each of the ingredients along with the total sugar value. And doing a lot on shopping patterns, the recessionary effects I didn't really present here, but just very briefly to note that the recession increased the calories that people purchase from grocery stores slightly. For every % increase in unemployment in a market, people actually did purchase a little bit more relative, controlling for everything else going on. And that's really just because we shifted from away from home, we were shifting to private label, we were changing what we were buying within each product grouping. And so it really wasn't an adverse effect on calories. That doesn't mean it was an adverse effect on health and quality of the diet. I'm just talking about on calories there. The future for us is doing an awful lot of work on one thing, but there are things that some of you can do. We can now, they collect WIC data several times on these data sets. They collect SNAP data. One could, for example, if we add it to our database, look at the WIC purchases and so forth. There's a lot of data on these food purchase data sets. It's every time you go to a shopping event, they scan what they buy. So you've got the frequency, you got the day of the week, you got the day of the month. You've got an enormous array of kinds of potential issues to look at. So that's really, And so my take home is the private labels, we've got to remember that, and we've got to be thinking about that a lot more than we used to. Shopping locations are really shifting and moving. People are traveling different amounts of distance. I didn't show it here, but people don't shop at one place. People shop at 2 to 4 places every month at least. And the combinations are very different by socioeconomic group, by location, by race, ethnic group, and so forth. The nutrient density of the consumer packaged goods really vary by store type, but that doesn't mean that if you compared the same category, they're less or more healthy. But people buy different things at different kinds of stores, and we've got to be careful when we compare stores to really standardize and look at that, or we're going to keep saying something that isn't necessarily correct. Disparities really do exist in where people shop and the nutrients they buy. And I'm not presenting it here, but it's a very meaningful, important kind of issue. And the last thing is about the need to engage the retailers. They're becoming, partly because of the private label side, partly because of the way they're moving a bigger piece of the pie, a bigger part of the game. We've always been focusing on the Cokes and the Pepsis and the Kellogg's and General Mills and talking about all of them, and we've forgotten this other sector. The convenience stores, the home scan data only shows about 6% of calories from them. It's clearly an underestimate, because if I go by a convenience store and buy one item, I don't take it home and scan it and so forth. So it's not clear the true role of the convenience store in our purchase patterns. And large retailers are becoming really important, and we've got to think of them along with food manufacturers when we talk about the healthier products. And that's just kind of the end, and this is our group. And if my colleague had been in the country, Xu Wenung, she probably would have presented this instead of me. It's really a group project, and that's it. I just wanted to use this as a broad sense, and thank you. And we're moving on to my colleagues from DC.
Good morning, everyone. So I'm going to provide a little bit of background on Convergence and the Project on Nutrition and Wellness, and how our coalition of stakeholders has come together around a collective vision and mission. And then my colleague Julie is going to share some of our retail-specific learnings and strategies that our group is currently working on. So the Project on Nutrition and Wellness, or PNW for short, is a coalition of approximately 50 stakeholders across the nutritional health space. We brought this group together really to take stakeholders out of their sector-specific silos and bring them together to pool their resources and expertise in order to create cross-sector collaboration to develop innovative solutions to really move the needle forward. And the Project on Nutrition and Wellness is Convergence's key domestic project, and at Convergence we believe that by bringing stakeholders together around a safe space for dialogue and bringing together a very diverse group of viewpoints and perspectives and expertise, we have the greatest opportunity to develop innovative strategies. And over the course of an 18-month dialogue, sustained dialogue, we bring our stakeholders together quarterly for 2-day meetings. And during this time, they have the opportunity for collective learning, for the sharing of ideas and agreement building, and then ultimately to develop innovative strategies to work together. And at our what we call our stakeholder table, we have representatives from the insurance sector, healthcare providers and associations, employer groups, a number of food retailers, CPG manufacturers, public health groups, community groups, and others, each of which brings a very unique viewpoint and expertise to a cross-sector dialogue. And at our table, we envision a transformed culture of eating where the healthy choice is accessible, it's affordable, it's enjoyable, it's desirable, and it brings improved health and vitality for all consumers. And our goal is to create cross-sector collaboration that catalyzes a shift in consumer demand, so building on the good work that's already being done in the marketplace through the various organizations and public health groups. And so our goal is to innovate strategies that leverage market forces, because we know that the consumer doesn't want to be told what to do, so we're looking at ways to incentivize and nudge consumers using existing market forces and create win-win solutions for the private sector, consumers, and public health. And our first few meetings were really focused on trust and relationship building and really getting a better understanding of one another's business models and missions and imperatives. And then at each subsequent meeting, we focused on one or two specific opportunity areas. So some of those include what can be done and what is already being done in the retail sector, what's working and what's not working, how we can change the culture of eating by communicating better with consumers and coordinating messages so they're not as confused by conflicting messages, looking what can be done with the captive workplace audience and how we can bring in more insurance companies into the mix and linking up both employers and insurers to more retailers, and also looking at what's being done at the community level and how we can scale up what's working successfully. And of course, overlaying all of those opportunities, we're looking at ways to develop strategies that really reinforce one another so we create a systemic approach to creating consumer demand for healthier foods, and then of course a focus on vulnerable populations given the higher rates of obesity and diabetes. And these logos are just a subset of some of our stakeholders at the table, some of whom are in the room. And after 18 months of dialogue, we're now at a point where our diverse stakeholders have coalesced around not only a collective vision and mission, but also a target segment of the population and a set of strategies that they can work on together to move the needle forward.
Together, Amy and I know everything, but she just knows the first half, and I just know the second. No. Happy to be here, and let me stress that although Amy's described our process in very neat, clean graphics, we encourage animated dialogue, and it isn't always a neat and tidy process, but that, I think, in and of itself has allowed us to go from simply hoping to forge relationships and trust to a point where our stakeholders around a very large table have asked us to help foment some discrete action. So I'm going to spend a little bit of time taking you through some of the ideas that have come out of the dialogue process. We also have heard from our stakeholders that they want to continue speaking, and as you can imagine, it's a very large space with lots of potential focal points and intersections, so we will continue to explore those. So not to spend, or belabor, I should say, the business realities of the retail sector, which we've already discussed in great detail this morning. So let me just highlight one additional perspective that we've looked at through PNW. It's important to our process that we honor the business case realities of everybody in the room while simultaneously considering the public health outcomes that we are collectively concerned about. And so this show me mentality, which is really true for any business, but given sort of the origins of the retail world and the need to demonstrate that there is business virtue or business case virtue in changing the planograms and changing the store layout and all the promotional calendars that have been borne out to be successful, we need to design strategies and new tactics that really allow the retailer to continue to enjoy the tonnage and the sales and everything that has very precisely been laid in place by them. So one thing we did with PNW, and then I'm going to spend a little bit of time on one of the behavioral economic-based programs that we hope to build out later this year. But one thing we did with PNW is we took kind of a meta view of the space, and we looked at where much of the attention has been focused by individual brands, by retailers, by policy folks, and other nonprofits. We've talked a lot about the school lunchroom, and schools get a lot of attention. So what we did learn is that the retail environment, while it does receive lots of attention thus far, could be more fully built out. And now that it is proliferating and growing in different ways, certain channels, whether they be the big box stores or the dollar stores or whatnot, or even online retailers, as they continue to grow and share in certain markets, could receive some strategic attention in terms of changing behavior of what is being bought so it's more healthy. Restaurants continue to be an opportunity area, and we also realize that the communications and media channel, particularly new media channels, was an area that many organizations have not embraced. While there are campaigns to drink up, and there are many good efforts in place that do have media messaging per se, the whole concept of eating healthy has really never been turned upside down so that it's a little bit less education and you should do this, but rather something that people kind of innately want to embrace because it offers them a personal value, not something that they're being told to do. So that's an area we may build out and try to just change the culture and make it a bit cooler, which is a word we heard in our room quite a bit. We also talked about areas to try to get folks to eat at home more, to cook more, and that again relates back to the store. Talked about current communications initiatives, and our area of expertise within this big table that we convene is to try to knit together all the activities that individual organizations are investing in so that they collectively enjoy more value. One of the parts of the program that we recently completed was to access some longitudinal data, consumer segmentation data that NMI Market Research, which specializes in health, wellness, and sustainability data collection, has been accumulating. And we, after quite a bit of analysis, honed in on a segment that they call the fence sitters, and we can certainly spend more time offline discussing that, but the long story short is it represents roughly 20% of the marketplace. Seems to be a very high potential for all of the pursuits around this topic in that it's dichotomous in nature. It has the highest incidence of SNAP and WIC participants of all the segments. It also has a more upper middle class component to it. So it addresses lots of marketplace potential. Attitudinally, folks in the fence sitters area are already predisposed to want to use food to honor their health concerns. And they have not disease concerns so much, but managing health and living a vital life and a healthy life. So we don't need to invest in convincing them that food plays an important role, but we do need to make it easier for them to do this. And we heard from that research, we learned that convenience, time management continues to be a big problem, and that resonates with some of the other research that we heard about. It's kind of a bimodal curve in there. Both groups are very much involved in managing families, and time is of the essence there. So we are dedicating a lot of the P&W energy to building programs at multiple retail settings. We want to look at cooking. We want to look at media messaging. And one of the programs that I think best suits this audience in particular is going to get some energy later in the year, and it comes out of the Cornell Food and Brand Lab. Dr. Wansink has been one of our stakeholders. We have lots of grocery retailers at our table and FMI as well. And so together our retailers, P&W stakeholders and Dr. Wansink are going to build a toolkit or a scorecard much like the USDA Healthy Lunchroom program. And it's going to be really a list of proven, I don't want to call them interventions, I want to call them opportunities of merchandising, changes, marketing ideas, potentially other categories that impact the retailer's geography and how the consumer navigates through that, but all of which will be either revenue neutral or revenue positive, as well as honor public health needs. So we'll build that together. We'll test it. It will be very much an opt-in kind of a program, and we hope that more evidence-based findings can be shared with the group as a result. Smart Receipts is another program. It's a little bit less specific to all retailers, but it's going to marry insurance policy holders' patient number with a grocery loyalty number, theirs, and then we can design discrete health-related messaging, diet-related messaging, nudges, incentives, rewards, and take it all the way through to biometric screening so that we can assess not only shifts in the grocery cart composition, but also health outcomes. So that'll be a test program that we're going to help launch. A little bit more about the retail scorecard. We are looking for ideas and participants. We have heard from some initial assessments in conversations with retailers that if there's a kind of a certification or an award basis at the end, that provides kind of value for these individual retailers to then share with their customer base. So it could be like a LEED certification. It could be a plaque that physically goes in the store. So it's going to be kind of the full spectrum of not just shifting what goes on, but shifting how consumers or customers engage with that retailer. Smart Receipts, we talked a little bit about. It would allow individual retailers to decide which healthy foods within their store format they would then reward. They could, we could develop icons that actually go on the receipt, so when somebody makes a purchase, they see which ones were really healthy or better for them. They could get statements from their insurance company indicating that they've done a good job, or here are some other products to consider. We could have CPG manufacturers help incentivize folks to actually make the switch. And certainly there could be an online presence so that more ideas and for shopping lists could be taken to the store. So what we're going to do in our second phase of the project will be to build out more and more retail-based program, not just traditional grocery stores, but convenience stores, dollar stores, online stores. We want to develop a culture change campaign that will be very much a media-based messaging campaign that different brands and retailers and nonprofits can engage with as they see fit, that honors their investment to date. We want to take a hard look at community-level interventions so that we can build out sort of a bottom-up as well as top-down program that helps folks, particularly SNAP and WIC recipients, achieve change at the grassroots level, change that they might not be able to do without the resources and voices of other groups. And we want to invite more insurance companies into the conversation so we can take this to the workplace, as well as maybe build out some new retail-based programs. Okay, great.